Texas Medical Board, but they're so overwhelmed. They have like 13 people on their board, and we'll see what comes of it. But I mean, at the end of the day, they can send her a cease and desist. But I mean, are they going to try to arrest her? I don't know. It's hard to say because there's no licensing board that would come after her.
This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate Dee. Together, we explore the wild west of medicine that is the aesthetics industry. Today, I'm speaking with Dr. George Davis of Houston, Texas. We are diving deep into why his state has become the wildest of the wild west of medical aesthetics. From sudden death at a med spa last summer to arrests for practicing medicine without a license, we explore why Texas law may be dangerous to your health. Hi, this is Dr. Kate Dee, and I am here today with Dr. George Davis. He is a doctor in Texas, originally went to the University of Texas at Houston Medical School, did an emergency medicine residency, but then went into medical aesthetics back in 2005, back when the industry was just a baby. Thanks so much for being here today.
Oh, my pleasure. When you asked me to come on here, I thought it'd be important to talk about it from somebody who's actually in Texas.
Yeah, well, Texas has come up quite a bit in our conversations about med spa law and people practicing medicine outside the law. So I was hoping to bring you on today to talk a little bit more about that and kind of understand why Texas is so different and what I would say kind of going wrong to lead to so many people practicing illegally.
So the main problem in Texas is that the delegation from a physician can be to anybody. They do not have to have a license. And that's where the problem starts.
So what exactly is supposed to happen? Is the doctor supposed to train somebody and declare them good to go? Or,
So you would hope that the physician who is overseeing somebody would at least know something about the procedures or the techniques that that person being delegated to is performing. And even in the medical spa industry, there's supposed to be some safeguards where they're supposed to have a visit before with a physician or even a nurse practitioner to set up some treatment guidelines. And they've gotten around this by having some person being like a delegating physician, just basically signing off on charts and then doing like a face-to-face visit with a nurse practitioner somewhere in Texas.
So let's separate those two things out here real quick. So The first thing is, who can inject in Texas? And the answer is actually anybody as long as a doctor says they can, right?
That is correct.
Okay. So they have to have a doctor who's overseeing them and making sure that they're doing everything properly and seeing the patient, with sterile technique, using the right procedures and protocols, using real Botox, all that. So my understanding is it's the doctor's responsibility for basically all the medical care in that med spa.
That is correct. The doctor is responsible at the end of the day for the acts or procedures that are performed in that med spa.
Okay. And then the good faith exam or the initial examination and diagnosis and treatment plan in Texas, that's supposed to be a doctor or a nurse practitioner, correct?
That is correct. Or even a physician assistant, yes.
Or a PA, but not anybody else, not an RN, not a, random person who a doctor says can inject Botox. They're not allowed to do the diagnosis part.
That is correct. It is spelled out in the Texas Medical Board statute.
Okay, but what you're saying is a lot of times these places farm that out to like a video call or something?
Yeah, so a lot of nurses that do this, they will have a video like basically a televisit with the nurse practitioner or the PA or even the physician, and then they can do that over the phone to examine the patient and say, this is what we're going to do today.
Okay. So, but as long as that happens, that's legal, right? To do that over video.
That's actually legal. And at the end of the day, it's probably okay because most of these injections can be performed safely if the person has proper training.
Sure. So if a doctor's overseeing it and a doctor makes sure that every single new patient has a good faith exam and diagnosis and treatment plan done by the right person, then any of these injectors who may or may not have any kind of license, that's legal for them to go ahead and inject. Okay.
It is perfectly legal in Texas.
Right. So what is actually going wrong here? Like where are people like cutting out the critical steps?
So what I'm seeing in a lot of the smaller towns is that anybody's just signing up to do this, and they're not having a medical director. They're not really following the law because, frankly, they don't think they need to. They don't want to. They think it's a burden. So they'll just somehow find Botox or fillers or whatever and start injecting, start treating patients.
So there are a lot of people who are injecting out there who have no medical director at all. So that's completely illegal in Texas, even in Texas.
Yes. That is illegal.
Okay. And where do you think they're getting the Botox or fake Botox, in your opinion?
I mean, I'm sure they can order it from, say, China or some other overseas distributor at a lower cost using an off-brand, off-label.
Yeah. So for our listeners, you cannot order real Botox or any of the other neurotoxins or the fillers from the legitimate sources here in America, Allergan or Galderma, the other companies that make them. Unless you're a doctor, you have to have your medical license in order to order them. So for these people who are call themselves injectors and they're on their own, they have no medical director, the only way they can buy the injectables is illegally off the internet. So they might go to Alibaba or they might go to other foreign sources for getting these products because unless they have a doctor, they can't actually get them, right?
That is correct.
What neurotoxins do you use in your med spa?
So we've used Botox primarily, and we've added Dysport and Daxxify. And we buy ours straightly from the distributor or the manufacturer, and they come in with safeguards. For example, Botox has a hologram on the bottle where you know it's legitimate. So those are things that you know that you're getting the authentic product.
Yeah. So, and it's pretty expensive, honestly. I mean, that's where we have both Botox and Dysport in our practice as well. And it's pricey stuff. There's no getting around that.
Yes, it is. And they keep raising the prices. So it is expensive, but that's the cost of beauty right now in America.
So if you're going to one of these places in Texas that has no medical director, they're very, very likely getting illegal fake Botox or illegal filler imported into the country. And for the most part, that's pretty cheap. So they are able to offer these services for much lower price than a place that's doing it legally and legitimately.
That is correct.
You were telling me that there's actually a company that offers weekend courses. Can you tell our audience a little bit about that?
So I'm seeing a advertisement on Facebook, and once you see something on Facebook and you click on it, you continue to see it. And so there's a business called Master Injectors LLC, and they set up programs in different cities in Texas, Austin, Houston, Dallas, and they will flat out tell you that come in, learn to be trained over the weekend. You don't have to have a nursing license. We'll provide a medical director. We'll provide a nurse practitioner for a face-to-face video. We'll help you with the protocols. We'll help you with all. Basically, set everything up for them for a fee.
And this is a single weekend course that they're learning this with?
It is correct. It's a Saturday, Sunday for anyone who's never injected. So it could have been, it could be for nurses. Obviously, they're probably a primary target because they're taught by nurses. But you could have estheticians. You could have massage therapist. I mean, my own daughter, who's 21, could go in there tomorrow and do it. Honestly.
So it's kind of amazing to me. I'm just curious, like, how long did you learn how to do it before you felt like you were an expert in Botox injections?
So as an ER physician, we're used to injecting and suturing. So we have a very basic understanding of anatomy of the face, how things work for injection. I mean, it could have been a few months to a year to really get proficient. I don't know if I call myself an expert, but I mean, I've done it for close to 18 years now. And so I'm pretty well versed in how to inject.
Yeah, I would pretty much say 18 years is expertise. I feel
Mhm.
like it took me, I was a radiologist before entering into aesthetics and had performed needle procedures my entire career and have a pretty good handle on facial anatomy, but then studied it all over again once I was starting to do these kinds of injectables. There are a lot of muscles in the face, and there are a lot of ways to go wrong with Botox and with fillers, especially. And I think that knowing anatomy is just critically important. So the idea of somebody who doesn't know any anatomy to do a weekend course and be sticking needles in people's faces is a little scary. But so so these people are non-doctors. They're taking a weekend course and then they're putting up a shingle and a website or an Instagram and injecting people, probably
Yes, that
with fake product. Okay. Well,
these people may get real product because they have a medical director, so they're doing it by the letter of the law. So they technically are legal if you think about it.
if there really is a medical director, yeah.
Yes.
It's hard to tell. So I've been looking around at various people's websites. Some people don't even have a website. They might just have an Instagram or Facebook profile, trying to figure out who's got a medical director, and they don't seem to ever be listed. They show a person. There's no credentials. A lot of them don't even have like an about us page where they show the staff. One of them, I looked to see if I could book a consultation or book something, and you can click through their entire booking profile and never see who the provider is that you'd be booking with. So they're
Nope.
in doing some research for this interview. I came across a case. It was from 2019, and there was a guy who was 26 years old. He had no license, and I'll leave his name out since this is really not about trying to name people. It's just trying to produce awareness as to what's going on here. But he's a 26-year-old guy arrested in Houston for injecting without a license or a medical director. And when they went to arrest him, the toxin he was injecting had a label that was all labeled in Turkish. And the thing is that because he didn't have a medical director, it's the medical director who would get sanctioned by the medical board. So the medical board has no say over this guy, right? So I Googled him and I found that he has a new med spa. This was back in 2019, and currently he's on the homepage of his own brand new med spa. Well, I don't know about brand new, but he's certainly back to injecting. And on that website, there's no medical director. So it's I know it's funny, but really frightening at the same time.
Well, it's just sad that as physicians, we're held to a high standard. So if we do something wrong, the medical board will come after us and sanction us. So that is what happens for us. For these guys, they can just keep going and going and going.
Because if they're not in jail, they can just go right back to their office and keep doing the illegal medical practice.
That is correct.
There was an example you told me about the other day. It was a woman who has an Instagram that she looks like she's some kind of cosmetologist.
Yes.
How did you run across her?
I really don't know how I found her. I guess in one of the ads that popped up on my Instagram feed, and her ad popped up, so I started looking at it. I don't see any type of license. She doesn't call herself anything but an injector. She has all of these before and after pictures of lips. She charges high fees. She's over in East Houston, but she does a lot of things that even I wouldn't even consider doing, like injecting Kybella in the mons pubis for fat reduction. Just things that are really way outside the realm of even a licensed person to do, much less somebody who doesn't have a license.
Well, and for our listeners, Kybella is an FDA-approved bile acid. Actually, is like made in your liver to dissolve fat, but it was used to inject the fat underneath your chin, and is FDA approved for that use. I did use it for a little while. In the end, I dropped it because it was not very effective and very expensive. And there were a lot of difficult problems with it. And ultimately, people weren't very satisfied with it. So I don't do that anymore. But there are some people who use Kybella still, which is fine. But there are people who are now injecting Kybella or, the same kind of bile acid around people's bodies to dissolve fat in other places, which is definitely not FDA approved. And one of the big problems with that treatment is that in dissolving fat, it's very dangerous to inject it anywhere close to a nerve because surrounding the nerve is a sheath of fat that protects the nerve. And if you injure that, you can, sometimes permanently damage the nerve. And so injecting that stuff kind of all around the body is super crazy dangerous. And we don't do it. What Dr. Davis is saying is that this cosmetologist who is clearly unlicensed is taking that substance and injecting it above the pubic bone, I guess, to treat. Do a lot of people have focal fat above their pubic? Is that a thing? I did not know that was a thing.
That is in Texas. Yes, it is.
So the focal fat that's above your pubic bone is undesirable. Okay.
Yes.
Well, that's interesting. Okay. But, super dangerous place to put that. So that's very scary. And then, as far as I can tell, so nobody's policing any of this. I mean, how is this possible?
So I reported to the Texas Medical Board, and so they're going to look into it, but they're so overwhelmed. They have like 13 people on their board, and we'll see what comes of it. But I mean, at the end of the day, they can send her a cease and desist. But I mean, are they going to try to arrest her? I don't know. It's hard to say because there's no licensing board that would come after her.
Right, because she's unlicensed. Well, maybe she's a licensed cosmetologist.
Yeah, possibly. I mean, they may come under that, but I don't know.
Yeah. So our first podcast episode, we covered the death of a woman in Texas at the Lux Med Spa from when she had an IV placed, and she died very quickly there. As far as I know, the Texas Medical Board sanctioned the doc, but then reinstated his license a few months later. So he's still practicing medicine.
Yeah, that is correct.
They did come out and do kind of a public warning about med spas and warning people that the medical doctor is in charge and you should be able to see the medical doctor. It was really interesting to see that interview. It was like a TV news interview with the head of the Texas Medical Board.
And we also got an alert saying that the use of IV fluids is considered the practice of medicine. And that was broadcast to everybody with a license in Texas.
Which for some reason seems obvious to me, but is there a reason that you think that people don't realize that an IV treatment is medicine?
Well, the way that it's being promoted across the nation right now is that it's IV hydration with some vitamins. So it doesn't sound like it's medical. And that's what most people are thinking. I mean, you can go to Las Vegas and get an IV bar, in your hotel. I mean, so it's become standard to get this done now. They promote it for after marathons. And that's what happened to this poor girl in Texas, is that she went in thinking she's going to get a quick pick-me-up IV. Next thing you know, she's dead. It was very sad.
Yeah, and I know I said this on my first podcast, but there's no quicker way to kill someone than to hang an IV with deadly stuff in it, like potassium or anything else.
I know. It was just we heard that just really reverberated through our groups and the community here because it was just really unheard of.
Well, what do you think should happen with those? I mean, I see we have these meetings. Aesthetic meetings are always in Vegas. I mean, I don't know why, but they always are.
Mm.
And we see these IV places popping up all over the place in Vegas. And I kind of understand the desire. Like if you're there to party for 3 or 4 days and you're super hungover after day one, I can see maybe wanting to get an IV and like go out and party again. But like how, what do you think should be done to regulate this to make it safer?
I mean, as a physician, they've already said that it's the practice of medicine, but the problem is enforcement. I mean, it's out there that it should be done by somebody who's licensed, but to what degree? I mean, do you license it to paramedics, to nurses, to LVNs? That's not specified. And so it needs to be cleaned up in the medical board statute.
Well, and so is there something happening in Texas now to try to either legislate this or, codify what is best practice or safer practice?
So a little background on the legislature. So we meet every 2 years instead of every 1 year, and the lobbyists will tell you that's a good thing because it's one less year for the legislators to do damage. So they can't pass any bad bills every year. So every 2 years, they try to ram through as much legislation as they can. And we had a nice bill set up last year with a lot of safeguards for med spas. And unfortunately, it was squashed by the lobbyists for the med spa industry, some of the manufacturers of the equipment and the pharmaceuticals, and ultimately never got heard in the Senate because there were some other political type legislative actions happening. So it basically got dropped.
I'm kind of curious to know who is a med spa lobbyist. I mean, I don't know of lobbyists for med spas, especially since the people we're talking about are, super illegal. Like, are they organized?
So it's kind of under the table, and we actually came across some of this. I know some nurses and NPs that were trying to, send out information to their colleagues that they need to call and fight this. But we came across some letters from some of the, or emails from a couple of the industry reps that were saying, hey, because if you think about it, if a lot of the nurses can't do this, they're going to lose a lot of business at the industry level. And so they were trying to promote it from the reps themselves on their own private email. And we found this.
So the sales reps.
Yep.
Okay, so the sales reps selling, well, probably not Botox because I don't think Allergan would support people who are buying fake Botox. So
I can't remember who it was, but I think it was one of the smaller injectables, one of the dermal fillers, one of the reps for them was doing.
Well, that's extraordinary. That would imply that any of the legitimate but smaller competitors to Allergan and Galderma might be selling it kind of without a doctor. That
maybe, or maybe they just see that whatever is, they didn't read what was in the bill. They just heard a bill was being passed and they just wanted to fight it.
Yeah.
We're gonna try again next year. We're in a group of physicians that are really trying to push for just standards. And we'll see what happens.
Well, I hope that actually happens. I know that AmSpa, so the American Medical Spa Association, is very heavily into legal compliance and helping people be legally compliant. And I know that they had put together a task force to list like best practices and try to present that, have everybody agree like these are best practices. But I know that a bunch of people who had been members in AmSpa, I don't know if they still are, but they completely objected to the standardization for safety. And I'm sure the people who are objecting were the ones who were not complying.
So I remember that coming out, and it was a big deal as well, too.
Yeah. Well, I think that they had started in Texas, I think, because Texas is so unusual in its lack of enforcement of, safety procedures that they started in Texas and it immediately got shot down. But this was before last year for sure. This was a few years ago.
Right. think it was the
And
last like 3 years ago.
yeah. And I think it's a shame because it would be good if there were some kind of national standards because the
Hmm.
laws are different in every state. And it is confusing for somebody who maybe, we move across states all over the place. Somebody who maybe was doing something legally in one state, it's completely illegal in another state, and they don't know. And they move and they set up
Right.
their place and they don't even know that they're being illegal in the new state. That would especially be true if you were from Texas and then moved anywhere else, because what
Yes.
you're doing in Texas is definitely not allowed in, as far as I know, any other state. I haven't figured this out yet, whether there's any other state that's quite as extreme as Texas.
No, a lot of the
Um,
states, they require you to be either a physician or a nurse practitioner to inject only, I think. Can't remember which one it was, Jersey or Mississippi, but I saw that recently, and a lot of people were saying that's how it needs to be.
well, it's interesting. That would take the job away from a lot of RNs who'd be very upset.
Yes, it would.
I think RNs can inject in most states. Um, they cannot practice independently anywhere, but they can
Right.
inject Botox and do other medical procedures in, as far as I know, most of the states. And that's a bone of contention. That's a whole different story, which is
Hmm.
RNs practicing independently without physician oversight, which is not legal anywhere. Um, but in Texas, it's literally everyone. I do think that the important thing to take home from all this, okay, because this is going on not just in Texas. So people anywhere in the country can decide they're going to take a course, learn, how to inject people and order fake products off the internet, order from Alibaba and function outside the medical system. And I have no doubt that's happening all over the country. I think the reason that it's happening more in Texas is because there is this idea that it is legal for them to do this, even though obviously importing fake stuff from China is not.
Right.
But I think that in large part the growth of the aesthetics industry over the last 10 years, a huge amount of that growth are people entering into it without proper training, without licensure, without doing it legally.
So this is interesting. So we interviewed an esthetician for part-time the other day, and she says, "Oh, my passion is to inject." So I think that's what everybody's coming out is that's their new passion is they want to do Botox and fillers because that's what they see. They get it done on themselves. They're in their mid-20s. They feel like we're the old school where we have to do things in a certain way. These guys coming out now, it's all over TikTok. It's all over social media. Why can't I do it? It looks pretty easy. And that's what they see.
Yeah. And as a physician, or as physicians, both of us know how crazy dangerous that is, because underneath the
Yes.
skin, there are incredibly many different vital structures that you could damage
Mhm.
or permanently destroy with your needle or with the thing you're injecting in the person. If it ends up in a blood vessel or a nerve, or God forbid, a blood vessel that connects with the artery that feeds your eye, you could go blind.
Hmm.
You
Yeah.
can, there are so many bad outcomes that could happen besides just having a funny looking face or an uneven smile. I mean, you can end up necrosing off the tip of your nose. I mean, there's so many bad things. You could be disfigured permanently. So the fact that they, think it's easy is so scary, because when you know what's underneath the skin, you know that you don't want to just go mucking around in there willy nilly.
Right. Well, from a standpoint of complications, I'm actually at a cosmetic conference now in LA, and it's pretty well attended. A lot of them are nurses that are here, and most of the morning was spent on complications. A lot of it was talking about blindness. They're showing cadaver dissections of the blood vessels, how they actually connect, and how not easy it is, but how it could happen. And it's kind of eye opening because it's really, even from my standpoint, just to see how these vessels connect all throughout the brain and all through the eye and the orbits, and it's kind of scary. And they say you have 90 minutes from a blindness to fix it, otherwise it's permanent.
Yeah. And you need to have your best oculoplastic surgeon friend in your back pocket or on speed dial on your phone if you need that person. And I'm venturing to say that most of these people who are not even nurses don't have a best friend who's an oculoplastic surgeon who can save their butts if this happens to them.
I'll be honest, in the Houston area, it's really hard to even think about it. I've tried to get us organized, and it's hard. It's just such a huge area. I think LA has a network set up for that, but even then, they told us story here that on a stage they were doing an injection. I want to say in Europe somewhere, and on stage somebody was blinded by an injection, and one of the guys was in the attendance, and they thought it was a urban myth, but somebody said, "Oh yeah, I was there and I saw it happen. It was chaos."
What happened to the person? Was it permanent for the person?
They were blind. I mean, think about it. Here, you're on a stage here. How close are you to getting anything done? You know, do you have a bunch of Hylenex here? Do you have all the tools at your disposal? Can you get them somewhere? That's the thing. So, but luckily they showed us how to do retrobulbar injections, and everybody freaked out.
That would be ridiculously scary.
Yes.
Well, I think this has been really helpful. What I'd like to wrap up with is what the questions are that you can ask if you're going to a place and you're just not sure about the provider there. I think the most important thing is, what license do you have to inject this thing that you want to inject? What kind of Botox it is or other kind of toxin. And you can even ask to see the vial when they mix it up. A real Botox will have a real Botox label on it, and not written in Chinese or Turkish.
Yeah. And it'll have the hologram. That'll show you that. So it's real.
Right. On the box, there's a hologram on the Botox vial. Actually, don't know. Yep. I don't think there is one on the Dysport vial.
No, there's not.
Not a hologram.
Botox they did that because they wanted to make sure that, it was real.
Yes.
But yeah, that's the best thing to ask is, what's your license? You can ask how long you've been doing this. Who's your medical director? Those kind of things are what to ask. And if nobody will tell you, you may want to steer clear of those.
Yeah, I think, who is your medical director, and would it be possible to have a consultation with the medical director? At least in my practice, medical director, or especially in Washington, I don't know what the law. I'm curious actually what the law is in Texas, but we have to be within a certain number of minutes availability, but also be present, review charts, review cases, see patients. I do all of the things that I've an NP and 2 PAs that work for me, and I'm present, and people can book a consultation with me. And so if that person is never bookable, like that medical director is just never there, then I really would steer clear of that place.
Well, I would about 10 years ago in Texas, this is another part of it, is a lot of the rules relaxed for the distance to supervise an NP or a PA, how many you can supervise, what the chart review is. And now it's down to, you can be almost any distance, I think, to supervise. You can have up to 7 or 8 under your delegation, and maybe 5% chart review, maybe. I can't remember the numbers, but it's very loose.
That is really loose. The other questions I think are really important to ask is, do you have emergency supplies on hand if anything goes wrong? If you're getting filler, make sure they have at least 12 or more vials of Hylenex in the fridge and know how to use it. Because of vascular occlusion, which could lead to blindness, the way we've been talking about it, is pretty much the worst thing that could happen in a medical spa. And you want to know that they're prepared to deal with that. If you're going to have filler and nobody talks about a vascular occlusion and nobody consents you for that, nobody explains that in informed consent, then run in the other direction, because, that means they're not really telling you the full story. And I kind of always think it'd be helpful to ask if they have malpractice insurance, because these people, if they do harm you, you have no recourse if there's no doctor and no malpractice insurance, So those are all questions that you can ask if you're going to a new place and you're not really sure. But if it looks sketchy from the website and there's no medical director on the website and there's no licensure at all, I would just not even consider it.
Well, Sadly, we're in the majority, but there's still a minority that really don't care. They look for cost. They want the cheapest cost, and they don't care, which is sad.
Well, yeah, and if cost is your only factor, then going to one of these illegal places, you're basically taking your life in your own hands.
Yes, you are.
On that note, George, thank you so much for being here today and taking time out from your busy conference. And I really appreciate it. And hopefully you'll be back on the podcast sometime in the future.
My pleasure. I'd be happy to.
If you have a question or a crazy story of your own that you'd like to hear on Med Spa Mayhem, contact us through our website, medspaamayhem.com, or check out our contact information in the liner notes. If you learned something today and like what we're doing, please give us a 5-star rating and read the book. Med Spa Mayhem is coming out June 11th, 2024. The link to pre-order is available on medspaamayhem.com. I hope you've enjoyed hearing about Texas today. Keep in mind that each state has its own laws, but the lack of enforcement is a national problem. We hope that the more you all know, the happier and safer you'll be. I'm really interested in hearing from you. If you have a question or a story to share, please reach out through our website, drkatedee.com. medspaamayhem.com will also get you there. Those emails come directly to my inbox, and I'd love to hear from you. You can email or send a voice memo directly to info@drkatedee.com. That's drkatedee.com. This has been Med Spa Mayhem with Dr. Kate Dee. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to subscribe and leave us a 5-star review. Oh, and read the book. Med Spa Mayhem comes out June 2024. Available everywhere books are sold. You can pre-order now on Amazon, Barnes & Noble, and at bookshop.org. Links and more can be found on medspaamayhem.com.